Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. I think we all struggle with understanding what's the best time, and it needs to be individualized, right? We can't just have a rule of baby has to be a month old or baby can't be more than a certain age. I think it has to be individualized. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome, everyone, to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and this week we will be talking about some of the biggest challenges that professionals face when assessing and treating infants with tongue or lip tie. But first, an exciting announcement, especially if you are a professional. Are you ready to become a sought-after expert in the tongue tie management world? We understand the challenges and frustrations that come with navigating tongue tie issues for new parents. That's why I am thrilled to announce the launch of our updated and enhanced course designed specifically for professionals like you. Why should you want to join our course? Because you'll have expert training. You'll dive deep into the tongue tie education aspects from identification to successful breastfeeding post-repair. You'll have comprehensive support. Learn not just the what, but the how, with practical strategies that will empower you to guide parents through this challenging journey. You'll be joining a community of professionals, a network of perinatal, dental, lactation, nursing experts. Did I leave anybody out? I didn't mean to. We are all dedicated to making a real difference in the lives of new parents and their babies. So what's new with my course? Our revamped course includes the latest research, advanced protocols, and real-world case studies to ensure you're equipped with the most effective tools and knowledge. Join the waitlist today and be one of the first to access our updated course when it becomes available. Spots are limited, and our community of forward-thinking professionals is growing every day. Don't miss out on this opportunity to enhance your skills and impact. Sign up now for the waitlist for the newest professional's guide to tongue tie in the breastfeeding infant. You can follow the link in the bio or the link in the show notes if you're watching or hearing this on the podcast. But you can also go to the website tonguetieexperts.net/waiting-list or just tonguetieexperts.net. Click on where it says pro course and the waiting list sign up is right there. Hope to see you on the wait list and inside the new professional Facebook group. So thank you for being here and listening today. I said that the topic is going to be today, what are the biggest challenges you face when treating infants with tongue and lip tie? And I will start with my own. Tell me if this is you, or if you're listening to the podcast and it's you, I would love for you to give me a comment or a review and say that I hit on some points that resonated with you because you experienced this. One of my biggest challenges is knowing the right time for release. You've heard me say this before. I used to rush to release. I used to think it was an emergency. We have to get this done. We have to fix it. And then I realized the intricacies of treatment, and it's not always an emergency. We have to find a balance, and I think it's an art. The balance of knowing when we should do this to baby to help them immediately, or if helping them immediately is actually going to set them back, or if doing something immediately is actually going to set them back. Now, I've done lots of episodes on this topic, so I'm not going to delve too deeply into this. But I just wanted to share that with you, that this is something that I'm working through. My protocols are addressing, and there'll be much more to come on this, especially in the new course, because I think we all struggle with understanding what's the best time, and it needs to be individualized, right? We can't just have a rule of baby has to be a month old or baby can't be more than a certain age. I think it has to be individualized. And I'd love to hear your thoughts on that. So I actually made a post on social media and I asked, what is your biggest challenge? And I've gotten a few answers that I'm going to kind of address, but not make it so specific because, nobody gave me permission to use their comments, but they're public comments. So from body worker, PT, OT, that type of perspective, also agrees about timing. They want to see babies as soon as possible, but in many cases, families have been told that the baby is fine. So unless they see someone like me or another skilled IBCLC who understands that this is a holistic treatment, they're starting everything way too late. So if they're seen by 1 month, this particular PT feels that that's a great time, that, before 1 month old, to help make changes in the baby's body before it becomes more complicated. And definitely before 2 months. That does not mean that they can't be helped after, but I see this as well. There are patterns of lactation, even patterns of feeding, habits that are formed, positioning that infants and moms get used to very easily that may not be the best for them. Sometimes people are supplementing and overfeeding when they don't have to. Sometimes they're not pumping enough. Like there's lots of stuff to be done in the first weeks, not necessarily the release, but preparing for it. So in the aspect of the holistic treatment of a tongue-tied baby and their family, there is so much that we need to accomplish other than having the release of the tie. We can call that preparedness or readiness, or, I like to think of the baby's body getting ready, the parents getting emotionally ready for the procedure, physically ready, recovered, if possible, milk supply being as regulated as possible, if possible. So there's so much to do when it comes to the first few weeks of life that are ideal and not waiting too long. Now, again, if you have to do this later, it's possible. We're just talking about challenges, right? And making it as easy as possible. And from the professional point of view, because it's very frustrating as a professional, and I hear this from people all the time, especially, the team members I collaborate with, that I network with, tell me this too. Like, I wish I would have known, I wish I would have seen this baby earlier because I could have helped prevent such and such and such and such, right? Torticollis is a big one. Reflux issues are a big one. We want to, talk about positioning for sleep, how the baby's sleeping, eliminating swaddles earlier, maybe eliminating the pacifier habit if possible. Lots of things to be dealt with. So that was a great answer. And if you were one of the people that contributed to that for me in the post, I appreciate it. Thank you. Okay, here's a big one. And this was sent in by an IBCLC. What is one of the biggest challenges with assessing and treating infants with tongue and lip tie? And this answer I totally agree with, and it's something I experience way too often. It's rush to release without any help from lactation, and then coming to lactation after the fact when the family thinks everything's already done and things aren't working. So this can be complicated because the parent is in a position where they thought they did the right thing, right? And they were told by someone, or they found the problem, they got the release, they went through it, wasn't an easy thing to do, but they thought they were doing the right thing and they did it. And sometimes things improve a little bit, but aren't sustained. Sometimes things don't improve at all, right? Or they improve and then they start sliding back. And that's when the family usually reaches out to an IBCLC and says, you know what, I thought we did this, but now you have to teach me how to latch the baby, or something's still not right, or I thought it would help with milk transfer, but it's not, or my milk supply is dwindling, all kinds of things like this. Or baby still wants to nurse all the time, or baby still can't latch. I hear this every day and it just breaks my heart. This goes back to one of my mantras, which is we want to be absolutely sure that even if there's a tongue tie, it's the tongue tie that's causing the problem. There can be a restricted frenum under the tongue, under the lip, but it may not be that lip or tongue tie that's causing the difficulty. It might be, but it might be the tongue tie in relation to any other number of factors that can affect breastfeeding management. So it's best to address, or at least assess and be aware of, the lactation concerns and be functionally evaluated by a lactation consultant prior to considering treatment for the tongue tie. I'd argue that being evaluated by a lactation consultant's functional evaluation is part of the treatment for tongue tie. And having the procedure without having lactation guidance in many cases does not result in the result you want, because the result we want isn't a free frenum or a free tongue. The result we want is successful breastfeeding or successful bottle feeding at this stage in life. So I hear you. I feel your pain. The IBCLC who shared this comment, thank you for sharing this comment. We have so much to do prior to a release, and it's not fair that there are dentists who will just release the tie based on what they see or based on an assessment tool that they think gives them all the information, where there's so much that we know that it's very difficult to help other professionals understand what we know. So they don't know what they're missing because they don't understand our full scope. Keep doing the good work, IBCLCs. Okay, getting back to the subject of today. What are the biggest challenges you face when treating infants with tongue and or lip ties? One of the answers related to the correct education and informed consent to families. So there are clinical findings that we see that we have to tell families who are at a very vulnerable time. So it's very scary to hear that there's something wrong with your baby. And no matter how gentle we are in enumerating this and sharing the information that we find, most of the time, what parents will hear is there's something wrong with my baby, right? So it's hard. It's hard. And I've been there. Not about tongue tie. I wish somebody would have told me there was a tongue tie. I was there with an infant who had a cleft lip. My third child, my youngest daughter, was born with a cleft lip. And I was informed at birth. It was pretty obvious and we all saw it. So I know what it's like to have a baby that has something wrong and a need to have something done to it. So it's overwhelming. It was pretty scary. And you aren't always ready to hear everything you need to know about it. I remember that. And I'm a healthcare professional, right? I was a nurse at the time. I wasn't a midwife yet. I was a nurse for a long time already. I had tons of experience, not so much with cleft lip and palate, but I knew about them and I had met babies and families with them. But I was not ready to think about the fact that something had to be done to, quote unquote, fix her. To me, she was perfect. I didn't want to hear anything. I was overwhelmed when people were sending me information about it. I was like, no, I don't want to know yet. She's doing well, and that's all that matters. Until I could absorb what I needed to absorb, both emotionally and heal a little bit physically. And then I was ready to consider what we were going to do to help my daughter. So I totally get that feeling of, as a professional, whether you're an IBCLC or a dentist or a speech language pathologist or an OT, a PT, maybe even a doula, a midwife, a nurse, you have this information that you have to impart to the family without overwhelming them. And it's challenging. And this is part of why I've developed my teaching tools that I share in the professional course, and I'll be updating for the professional course, because there are ways to do this that are meeting families where they are and not being in a place of, I'm the medical person and I'm talking down to you. You want to meet parents where they are. Help them to see what you're seeing in the baby. Help them to understand what they're experiencing with that baby is valid, and here's the reason. So I think that's vital, like letting them be in the discovery with you and talk to them about what you're seeing and what that associated symptom may be like for them. For example, a lip tie and a baby who curls their lip in because there's so much tension there. You can actually communicate to the parent that that's why you're having that specific type of abrasion where you are on your nipple, and demonstrate on the finger and show how that could cause a pressure sore where the baby is putting so much pressure and why they're holding on so tight, and letting them understand the connection between what you're seeing in the baby and what they're observing and knowing instinctually for their own child. The other part of educating families that's often a challenge is if they were given bad advice or told that there was no tongue tie, or the baby needed to be released right away, and now you have to tell them something different, or if their failings weren't validated at another professional office by other professionals and they were dismissed. Now you have to tell them that that other professional, and this sounds weird, but the other professional wasn't right. Their feelings are valid. It's true. What they were suspecting or not is true. The baby does have a tongue, a lip tie, or whatever, and this is what we need to do. And sometimes that's the most challenging part is, no, my baby doesn't have a tongue tie. I already got that checked out by Dr. So-and-so and Dr. So-and-so and Dr. So-and-so. In the example of the story in one of our podcast episodes, it was 17 professionals this person saw before the tongue tie was discovered. So now they're coming to you and you have to tell them, well, actually, all of those professionals were wrong. This baby does have a tongue tie. There's a grace to doing that. Sometimes you feel really, really like you wish you didn't have to say that. I've been in situations where I want to just like say, I wish everything you were told before was true, but it's not. And then explain why. I feel like this is a great time to have a lot of professional references, a lot of research that you can share, other parents' stories that you can share, things like my podcast stories that you could share with parents so that they realize that you as the professional seeing them that day is not making stuff up. This is real, it's true, and this is why they're having the breastfeeding or other feeding concerns that they're having. This is why they're maybe having pain. This may be why they're having reflux. This may be why there's a milk supply issue, etc. Whatever is going on for those people. Another challenge, so getting back to the topic, what challenges we face as healthcare providers in this field when assessing and treating infants with tongue or lip tie is when a family comes to you because they had the tongue tie treated, they had what they were told was a tongue tie release, and now they're seeking more help because things are not improving for them. And when you examine the baby, first you wished you knew what it looked like before because you're still seeing a tongue tie, or you're seeing a released frenum that has scar tissue now, or you're seeing a released frenum that was only partially released. And this happens a lot with anterior to posterior ties. And you have to communicate that to the family. So in the example of the anterior to posterior tie, this happens so often in my practice because it's easy for healthcare professionals to assess that there is an anterior restriction. That's what we learn about in school. We learn about anterior tongue ties, the heart-shaped tongue attached to the tip, obvious to see. The baby can barely move their tongue in the front, and it's very easy to assess and diagnose. And those babies are usually sent for treatment to someone quickly. The pediatrician might treat it. They may send to an ENT. They may send to a dentist who does not really often treat tongue ties and doesn't have the volume or experience in tongue ties, sees the anterior attachment. And a lot of times these are scissor releases because it's pretty easy to release the front anterior tie. And then things don't get better. So they're seeking you out saying, we had the tongue tie done, and you look under the tongue and there's a beautiful posterior tongue tie. Doesn't look like anything was done. And now it's your job as the professional to communicate that information to the family. This is a challenge. I've been in this situation way too often. But when I explain what I just explained here about what we learn in school and it wasn't their fault, even though maybe it was their fault, the healthcare provider's fault for not knowing about it. I think we should all be responsible for learning post graduation, right? Post certification, keeping up with the latest information. But if a baby is having trouble feeding and they see an anterior frenum, it's easy to say maybe that's it and have it released and talk about speech issues and stuff like that. But we all know, or if we don't know, we're learning that often the most challenging feeding happens with the posterior tie. Some of the babies I've seen with intact anterior attached frenums do beautifully with feeding if the back of their tongue can move. So this is a very complicated assessment based on function, and this is what we have to explain to parents. Not always do I have to send them on for more release, but a lot of times we do. But a lot of times we're going to do other work before, right? We're going to do all the preparation, all the readiness, the exercises, all the things that we talk about on this podcast and in the course, all about preparing families for the release. So important. So if you have anything to add, I'd love it for you to come over to our newest Facebook group. I want to get the name right this time because I am so bad at remembering all these new names. It's the Tongue Tie Experts Pro Community. You can check that out. All professionals are welcome. It doesn't matter your title, your license. Come on over. Tongue Tie Experts Pro Community on Facebook. Join us there. Let's talk about this, right? So this video will be there if you want to come underneath the video and add to it. Let me know what you're thinking. I think it's really important. If you're watching on Instagram, feel free to comment underneath. Let me know your thoughts. And as always, thank you so much for everything you do for parents, for families, for breastfeeding, for infant feeding, and for health. So thank you again. And don't forget to sign up for the waiting list for our newest professional course launching this summer. The wait list is live. You can just go to tonguetieexperts.net/waiting-list, or just go to tonguetieexperts.net and click on the pro course and the waiting list will come up. And if you go through that way, the invitation to join the Facebook group will be there once you sign up. Okay? No spam, I promise. Not too many emails, just enough to keep you informed. And hopefully you'll be joining us soon. So thank you everyone for listening today, and we will talk soon. Bye-bye. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.